Hi, my name is Katie Cosimi. This is LC, 54-year-old female who so graciously volunteered to do a head-to-toe assessment with me. So her bladder is empty, her vital signs are stable. Wash my hands. I'm going to start the assessment. Just looking at the patient, she's sitting there comfortably. I see no extra effort put into her breathing or anything suspicious at this point. As we move closer in, I'm inspecting her face. I'm inspecting her eyes and ears for equalness. I'm looking for any drainage present. I don't see anything there. I'm going to start by the head and palpating the head. And the scalp as well as the hair for any pain.
No.
And her hair feels normal. We're going to palpate the ears, the auricle for any pain.
No.
Good. Then we're going to move on to the lacrimal apparatus here. Any pain?
No.
Good. So we're also going to do the sinuses. Any pain noted?
No.
Good. Any pain?
No.
Good. So nothing abnormal there. We're going to start with the ears. Look into the ears here. No drainage present, tympanic membranes intact, pearly gray. Up and out, no drainage present. Tympanic membranes intact, pearly and gray. We're going to do a hearing test, a few hearing tests. So I want you to cover your left ear. I'm going to say a word. This is the whisper test and have you repeat it.
30.
Yes. And then just cover your right ear.
10.
Good. So positive whisper test. We're going to move on to the Weber test. We're going to see if this is, you can hear this in both ears equally.
Yes.
Good. And then we're going to move on to the air-bone conduction test. I'm going to put this on your mastoid bone. You should be able to hear it through your bone. Let me know when it stops. Can you hear it?
Yes.
Can you hear it?
Yes.
So air is greater than bone conduction. Same thing on this side. Can you hear it?
Yes.
Come in fast.
Okay. Yes.
Good. So positive air bone conduction test. We're going to move on to the eyes. Just flip your eyes. Your question. Assessing. I see no drainage, like I said. I'm assessing pupillary response now. Pupils are round, equal, reactive to light, and accommodation is present. We are going to test, and this is testing the optic, oculomotor, trochlear, and the abducent cranial nerves as well. So I'm going to have you cover one of your eyes and focus on an object. You can have your glasses on. So cover your eye, focus on an object, and then remove this. I'm looking for any extraocular eye movements, which I don't see. Same thing with the other eye. Good. And like I said, no extraocular eye movements noted. We're going to move on to the vision test. So I'm going to have you cover one of your eyes. Read the lowest line possible.
9, 3, 7, 5, 6.
Good. And then your other eye.
9, 3, 7, 5, 6.
Good. And then we're also going to assess her field of gaze. Can you just flip your glasses up for me for any extraocular eye movement or nystagmus could be present. So just follow your finger with just your eyes only. Good. And no extraocular eye movement was noted or no nystagmus was noted. So we're going to move on. I'm actually going to have it. This is cranial nerve number 1, the olfactory nerve, which is sometimes not used too often in the hospital setting, but we're gonna test it. So just tell me what you smell.
Coffee.
Good.
Lemon.
Good. And I just used smells that would be noticeable to people. So okay, we're gonna move on. So oral mucosa, we're gonna have you open. Just looking in, inspecting teeth, mouth color, soft and hard palate, any open sores, drainage, structure of the mouth. And I'm gonna have you stick your tongue out and move it from side to side, and that's the hypoglossal cranial nerve that we're testing. And then say ah. Good. And a gag reflex was elicited there, so that's the vagus nerve that we're testing as well. Okay, so we're going to move on. So I'm going to be palpating. I'm going to palpate the lymph nodes for any abnormalities there. So I'm going to start from the back, the occipital. Good. And then we're going to move on to the post-auricular. Good. The pre-auricular. Good. Submandibular. Good. Submental. Good. We're going to do the posterior cervical chain. The anterior cervical chain. The deep posterior cervical chain. Okay. And then supraclavicular. Good. And then we're assessing her neck. We want to see the trachea midline, which it is. We can assess her thyroid either from the front or the back. Just palpating for equal and central, no deviation. Which is good. We also want to listen for the carotid pulses bilaterally, one at a time. So we're just moving on to her upper body and her upper extremities. I'm assessing skin. I don't see anything abnormal. Just feeling for temperature, which is warm. Her skin is warm. We want to assess brachial pulses bilaterally and radial pulses bilaterally. Good. Just positive pulses. I don't feel bounding. They're not fretty. They're normal pulses. Looking at her hands, her skin's normal color, temperature's warm. We're assessing capillary refill. She has good capillary refill, so peripheral perfusion is intact there. We're just going to move on to the chest and the lungs. Respiratory rate is normal, within normal limits. She's not using any accessory muscles to drive that respiratory rate. So inspection, I don't see anything abnormal there. We're going to move on to percussion for the possibility of any fluid buildup or any abnormal sounds. Assessing bilaterally. Good, so percussion reveals nothing abnormal there. I'm gonna test for tactile fremitus. I'm gonna have you say 99.
99.
Good.
99. 99. 99.
I don't see anything abnormal there. I'm gonna assess for diaphragmatic excursion. Normal is about 3 to 5 centimeters of the movement. So we're gonna take a deep breath. Good. One more. Good. I'm gonna come around here. Deep breath. gonna listen for lung sounds bilaterally. Good. I heard no adventitious breath sounds that would be concerning. So her lung assessment is pretty much benign. I see nothing abnormal there. I'm palpating now for the heart and feeling for any heaves or throws or abnormal heart effort. I feel nothing there, so we're going to move on to hearts, to listening to the heart. So we're going to listen to the aortic area, pulmonic, Erb's point, tricuspid, and then mitral valve. Good, heart sounds are present, S1, S2, I hear no murmur, no bruise, no thrills are noted. I'm looking at her neck and assessing for any jugular vein distension. I'm going to have you lean back a little bit, about a 45-degree angle, and there's no jugular vein distension noted there. So we're going to move on to the abdominal assessment. If I could have you just lay back. So moving forward, I'm looking at the abdomen. I see no pulsations or abnormal abdominal movements there. Just assessing her skin's intact. I see nothing abnormal there. We're going to move on to percussion. We're just percussing the abdomen. Border, abdominal organs, the liver, the kidneys, and the spleen for border. Okay, so we're also going to listen for the areas of the arteries in the abdomen, the aorta, the renal, bilaterally, iliac, and femoral. Vowel sounds are positive in all four quadrants. We're also good. We're going to then move on to palpation of the abdomen for the kidney, spleen, the liver. We're going to start with a light palpation. Any pain?
No.
And we're going to go for a deeper palpation. We have the liver border over here, the splenic border, kidney, a midline for the aortic pulsation will be felt there. Good. You can feel her aortic pulsation there. I'm just going to cover her. We're going to move on to the legs. Assessing her leg, the color's intact. This hair distribution is equal. I see nothing concerning at this point. Her temperature again is warm. I'm going to assess her popliteal pulses, which are positive. Positive. Posterior tibia, positive. And her dorsalis pedis pulses are positive. Capillary flow is present on her feet there. So I see nothing abnormal or alarming at that. Okay, I'm going to have you sit up. I'm going to move on to neurological exam. Her olfactory, we test it, and the optic nerve, which is the vision nerve, we test it. The oculomotor trochlear, we're tested. The trigeminal is the facial sensation. Would I be clench your jaw? Good, and that's good. Cranial nerve number 7 is the facial nerve. We're going to have you squeeze your eyebrows up. Good. See the movement there. Puff out your cheeks. Good. And smile. Good. And her movements are equal. I see nothing alarming now. We tested the acoustic, glossopharyngeal, and the vagus, as well as the hypoglossal with the tongue movement. I'm going to have you shrug your shoulders. Good. That's the spinal accessory muscle, which is tested there. I'm going to move on to the reflexes. So just uncross your legs for me. Good. Good. Just relax. Good. Good. Just relax. So her reflexes are positive. Everything that is pretty much normal. I'm just going to do a sensation test. Just close your eyes. I'm gonna touch you with either a pointy object or a soft object. Just let me know what it is.
Soft. 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 Point. Point. Point.
Your face.
Point.
Good. While you're here, I'm gonna test strength, muscular strength. Just push against my hands. Good. Push against my hands. Push back. Push in. Push out. Now with your arms, push against me. Pull back. Good. Shrug your shoulders. Good. Against my hand. Good. Against my hand. Good. I see nothing abnormal there. Muscular movement is equal bilaterally and throughout. Then for the final part of the exam, I'm just going to have you stand up. I'm going to look at your spine. Okay, so I'm assessing her spine and her back, and I'm going to have you bend forward slowly. And I'm just looking for the spinal cord to remain even and midline throughout, which it is in her lumbar and sacral and cervical area. So come back up towards me and remain the same intact in midline. So that concludes our test. Thank you very much. And thank you.
You're welcome.